there is a reward at the end. And that reward is much more beautiful than you expect. You get full registration, you get permanent residency, you get paid lots of dollars, you can support yourself and your family, you can have brilliant future here in Australia in whatever specialty you choose. And it's just a matter of putting in the hard work. So I've called this session Growing Further. And no matter how you want to take it, growing further may mean that you are thinking of post-graduation. So if you're in for something else, don't waste your time. Go on and do something else. This is all about training pathways, specifically if you've passed your AMC Part 1. If you have not sat your AMC Part 1 and you're thinking about the other pathways, maybe you're not going to get much out of it. Okay. So we want to keep it very specific. And by the way, once the number hits 100, then we can't take any more participants, and they have to rely on the recording. So I'm sorry about that. Okay, so let's start. This is us. Gosh, it's a long way. Simra, can you find yourself there somewhere? I'm not sure. Maybe you can, but I'm pretty sure you.
Yes.
So anyway, we've been in this space for close to about 5 years now. And it's a very interesting journey. I've learned a lot from each one of you, obviously, which is built upon my own learning and my own journey working as an IMG in 2 different countries, UK and then later here in Australia. And yes, we've got some remarkable stories to share with people from various backgrounds, getting jobs, doing good, and getting into the training schemes, which I want to basically talk about today. All right. So I want you to think about the difference between the first job that you might be aiming for and the second job, which will also be your aim after the first job finishes. And this is a fundamental thing that we're going to understand today. That what's the difference? Obviously, the first job is a bit more diverse. You're applying for general medical officer position, you're applying for emergency position, you're applying for recruitment campaign. And the second job, you tend to be more about, oh, I need to get into the WBA program. Oh, I've done the AMC clinical. I need to join the GP training program. So I need more specific experience in terms of pediatrics or NG. Oh, I want to get full registration. And even though I've done AMC clinical, I could not really get many surgical positions. So my target now is to do 3 months of surgical position or ED position. So I think the difference between the first job and second job, the second job is more career oriented. Okay. So whatever you're planning, that's where you need to step yourself up. And I've done recently a video which has been uploaded on my YouTube channel as well. That first job is easy, at the same time very difficult. Easy because you're not thinking about anything specific. You're not career oriented in terms of surgery, medicine, GP, OB&G. You're just focusing on getting the first job. And thankfully, most of the jobs which are for resident medical officer at level 1 or at level 2 are very generic. So you don't have to really modify your CV a whole lot. You don't have to really trim your application form responses, as long as you're able to display that you've got relevant experience that demonstrate that you're able to work as a safe doctor. So this is something which I'm going to talk about. So look, I want to give you a bit of an introduction. These are all the doctors that I work with. Okay. And these are all specialist doctor. Now, I tend to talk about that everybody, almost, I think, more than 2/3 of you will end into being general practitioner. And that's completely fine. It's more autonomy. It's the flexibility of hours. And perhaps you're at that stage of your career where the training or rigorous training I might add, might not be your cup of tea. And you think that, look, general medicine or general practitioner training program or GP training program, 18 months, 24 months is probably just about what I can have it. And that's fine. But I just wanted to show that these are the doctors who, amongst yourself, with a very similar credentials, pass AMC 1 only or AMC 2, have actually done all of that. So this first one is actually my very good guiding angel. He's a person who, his name is Arvind. He's working as a cardiologist now in Sydney. And he is from India. And we used to work together in the UK. And he actually encouraged me to come to Australia because I was quite impressed. Oh, Arvind, you're going to Australia, that country with built buildings, and he said, yes, I'm going to Australia. And I then followed his lead. And then the second thing which he did for me, that he was working in Sutherland St. George Hospital. And he said to me, oh, why are you going to Bundaberg? You better come and work in Sydney. There are plenty of jobs in Sydney. I said, wonderful. I'm going to train in emergency. This is another colleague of mine. Some of you may know him. He works as a emergency consultant in Blacktown Hospital. He's an emergency medicine consultant. Dr. Fatima used to work as an RMO in general medicine and emergency medicine back where I was working as a registrar, and now she's working as hematologist and oncologist. Hematologist, I think, in Newcastle area. And then we've got a doctor. I'm forgetting her name now. Look, maybe. So I think her name is Dr. Mehreen. Yes. So she said to me once that I want to do anesthesia, and she's from Pakistan. She's done just AMC1. And I said, look, okay, fine. But how are you going to achieve that? Anesthetic training schemes are very competitive. And she said, well, I'm going to try whatever I can. And she did that. She did her training, she got onto ICU, and then she did the anesthetic unaccredited, and she got onto the anesthetic training. This is my class fellow, Dr. Noman, who is working as a radiologist in Queensland region. Then Dr. Imran, who's working as a cardiologist. This is a very famous gynecologist who's also from Pakistan, and this is an orthopedic surgeon. So nothing is out of bounds. All right. You can achieve whatever you like. And you've recently may have heard Dr. Simra is actually now working as a psychiatry training. There's plenty of opportunities there. Now, in terms of comparison, whenever you choose your training program, you've got to be aware about what you're getting yourself into. Yes, obviously, GGP is very easy to enter into training scheme because there are lots of opportunity. However, you've got to realize that you have to complete a component of hospital training unless and until you're dabbing into, one of those specialist and PEP pathways and fellowship support program and pre-fellowship program. There are many different alternate pathways, but most of the international medical graduate tend to go via the full registration pathway through either an FSP or a GPT. And that is 24 months of training. Flexible work hours during training. Most of the people tend to do full-time training, but afterwards, obviously, you can train and work flexibly. Most of the positions are in, I would say, MM2 rural or plus, especially if you're going to AGPT. You may have heard your colleagues getting, training position in Albury or Vincentia or someplace like in regional Melbourne. And that's how the training schemes are designed to be. There are moratorium restrictions in place, which means that even when you complete your training, you've got to work in that area or similar kind of area for at least 10 years, which includes your hospital component of training as well, till you're able to work freely or come back to the major metropolitan areas. And the earning is directly linked to the number of patients you see. The more hard you work, the better you get trained, like the better you get paid. There's no salary structure as such for the GPs. You bill Medicare and Medicare bills you. Medicare pays you for the number of patients you see. A specialist, yes, the entrance could be competitive. However, there are certain specialties which are quite welcoming. For example, if you want to get into basic physician's training, that's open to all. Okay, there's nothing too fancy about it. If you want to do emergency training, fine. Plenty of emergency registrars needed to be trained. You can do that. If you want to do psychiatry, good opportunities there. Dr. Simra has gotten a training rotation in Sydney. So plenty of psychiatry positions in there. You need to have invested at least 4 to 5 years after your AMC exams in the hospital system to be able to get on to the training program, because you would need full registration and permanent residency, which are the essential components of getting on to the training program. Unless and until you're working in some area where they are very desperate need for the doctors and they may make a conditional allowance, which happens sometimes in psychiatry or emergency, that look, okay, fine, we'll offer you a job, but this job will be based on once you get your permanent residency. Most of the position in all the hospital training position are in region or urban training areas. So you might find yourself working in Sydney. Now, I did all my training in Sydney. And even though I was an international medical graduate, is still restricted by moratorium. But in hospital, moratorium is fulfilling, and you working in capital cities, Sydney, Melbourne, Adelaide, Perth, all the nice big towns. And stable permanent jobs. If you are able to work as a specialist, you get drawn a salary, and the salary, are very good. You can start off with a consultant, training salary of about $120,000 to $150,000 per annum, and that increases to about $250,000 per annum when you're working as a junior consultant, and goes up to about $350,000 to $450,000 per annum. That is gross salary minus the tax. So there's a comparison to be drawn, and I want you to be aware of that. There are two very distinctly different pathways, and it's up to you to choose and make a very conscious decision when you're choosing and committing to yourself to a general practice, or you want to go into a general specialist practice. Now, there is something which I come across recently. It's called a specialist training program operational framework. But this specialist training program is rural. Remember, we were talking about that specialist training program can only be done in the city setting. Well, there you go. This is a training program which is funded by the Commonwealth. And if you really are desperate to get into surgery, medicine, and I'll show you which are the specialties included in that, you can train yourself in rural regions. At least 2/3 of your training can be in regional, rural, private, public, clinic combinations. So if you're desperate to become, a surgeon, or, you desperate to become intensivist or pediatrician or cardiologist or respiratory physician or endocrinologist, well, that is something to consider. Okay. And this is a program which, so, I often talk about vocational training. So vocational training is the training for the specialty. So when I'm saying pre-vocational, I mean intern or house job, RMO1, RMO2, RMO3, RMO4, 5, 6, 7, 8, 9, 10. As long as you stay in that sector, that's all pre-vocational. Vocational is your specific training. Okay. So this actually says that your vocational training for specialist colleges into settings outside the traditional metropolitan teaching hospital. And 66%, so maybe about 2/3 of the training is in about MM2 to MM7 area. So that's the GP jobs that you're going to get. So you can say that this is a counterpart to a GP, but it's a specialist training program. And there's funding into it. You get paid for that, obviously. And there's some more information which is available on individual college websites. And these are all the colleges which have signed up for it. So there's College of Emergency Medicine, Intensive Care Medicine, dermatologists, physicians, surgeons, ophthalmologists, obstetrics and gynecology, psychiatrists, radiologists, sports and exercise physician, Australian New Zealand College of Anaesthetists, medical administrator, if you don't want to do anything else but medical admin, and pathologists. So there's a lot of opportunity there. But you might be thinking, oh, how can I get into it? Is it for the people who are getting their first job? No, it's not for the people who are getting their first job. They should have completed at least 2 years in a metropolitan hospital. They should have been accepted into a training position already in the mainstream. So if you're wanting to become, say, a physician or internal medical specialist, you would have been formally accepted or passed the basic physician's training exams, BPT exam, and then you are in the hospital training scheme, and then you express the interest that I want to train into the regional and rural Australia, which increases your chances of getting into the suitable training pathway. And they do actually have got a timetable and jobs. So it's, I think, worth exploring, because rules and regulations do change. They may be able to framework you early in the regional and rural training schemes rather than doing the hospital component at all. So this is something which you should really consider. So there is who's not eligible? Post fellowship. So if you've done your fellowship, you're not eligible for that. General practice, because general practice is already in regional rural setting. They don't need any more people. There are, cost involved in that, but that you don't have to pay, you get paid. There's a Commonwealth funding behind it. And, their contact details. So take a screenshot, whatever, you can send them an email and find more about this program as to what it's all about. Everybody so good? All right, excellent, excellent. This is what I found on their website when I was looking it up, that their last round of application just closed recently. 4th of April 2024. So they do attract de novo applications, that mean. So it's worth looking into it. And there is a link which you can have a look at, this one, which is an RACP link. And it actually tells you everything in detail about this pathway. So worth following that into. So essentially, I want you to leave yourself with a feeling. What do you love to do professionally? And how do you plan to do it? And then for everything that you want to have a plan, have one plan A and plan B, because things may fall out of favor. You may no longer consider a specialty or specialist pathway, and you might like to have a dual training pathway. There's many dual training pathways as well. So have a plan that often involves talking to a mentor who has gone through that same phase again. In this day and age, there's a lot of information, and we've built a whole community out here through Emergency Focus, and there are plenty of mentors. People often feel that we do charge for mentorship in terms of one-on-one career guidance session. But look, if you are getting a valuable advice for your future, which will help plan each and every step of the way, I think the price is just a secondary issue. I know this price could be exorbitant for people who are not working, but I think having a session done would help you plan everything in advance rather than trial and error and wasting a lot of time. Because whenever you're accumulating a gap, you're actually yourself pushing yourself back in the queue. So if anything, you want to take out anything from today's talk, avoid gaps in clinical practice like a plague. They are not your friend. They're not going to do you any favor. I cannot do anything about it by creating CPD courses or observership programs, or you cannot publish, you cannot do telemedicine. Gap is a gap. So you need to find ways to fulfill it. There could be recency, there could be some other ways of getting a formal job back home in your own country. And I know there could be some restriction when you're thinking about gap, but you have to take it seriously. Now, if your gap is 1 year or less, then I don't think it's much of an issue. 2 years, yes, it is coming to a point where, you might not be a first choice and you may have to look a bit more distantly. But if it's 3 years plus, you are in big trouble. Okay. So I think your career in Australia or anywhere else for that matter, even back home in your own country, depends upon your clinical experience. And I've just gone and give you a bit of a highlight on clinical gaps. Your qualifications, obviously, everybody's got MBBS, everybody got AMC1. So ignore those qualifications. They don't even matter. When people send me text through different formats that, look, I've done AMC1, or if I do AMC1, what are my chances of getting a job? I think there's a fundamental understanding lack there when they're associating MBBS and AMC as qualification, which will put them at some sort of pedestal to have a job. It doesn't work like that. There has to be some desirable credentials, and we'll talk about that. Now, I have been doing CV close to about 3 years, and trust me, I've seen each one of your CVs, and some of them have been done brilliantly. And those are the people who actually book me up for an interview session. And I can see the reason why they've been shortlisted for an interview, because their CV are just so good. And what makes a good CV, we'll talk about it. And then they really put an investment into their interview. They don't take anything lightly. They said, okay, fine, look, I've got this interview. I need to really prepare well for this interview, because if I don't get that shot, I might be bad into the same system of being unemployed for who knows how long for. So these are the things, or 5 things, that you must consider very, very importantly. No gaps, your important qualifications beyond AMC1, your desirable credentials in terms of having, what have you done here in Australia if you're here, or whilst you're coming or waiting to come to Australia, what have you done in your country to stand yourself up above the rest of yourself? How and what does it mean by perfect CVs? and what are the perfect interviews. Okay, so we'll talk about that. So we need an action plan, right? So you're all getting a free session now, one-on-one, so you can no longer complain that I charge too much for my sessions. You're all getting Dr. Simra and myself for completely free, of course. Isn't that right, Dr. Simra?
Yes.
And trust me, I would talk about the same thing in my one-on-one career guidance as well. Would obviously that one is more adjusted towards your CV, but this is just a generic out map, okay. So you need to perform when you're working as a resident if you want to stand out. You need to achieve when you're working as a registrar if you have been in that kind of category. And let's take it a bit more in depth. So if you any of you need a break, you can have a break. It's not that you need to sit here for the whole 1 hour. This will be uploaded. There are people, I don't know how many people who have not been able to get into, but as I said, I will upload this whole recording onto our Facebook page soon. All right, so let's talk about the action plan. Now, this is for the people who are not yet in Australia. And I think the talk won't be worth its salt if I don't talk about those people. These are the people who are at very basic or beginning. And that's what I'm trying to talk about, that avoid any gaps when you're choosing your jobs. Do jobs in medicine, do jobs in ED. And why I do say that, there is a scientific reason, because majority of general medical rotation have got a cluster of general medical and allied job positions. They've got ED component. Majority of standalone jobs which are there for about 1 year are ED or emergency medicine jobs. So if you don't have those essential components in your CV beyond your internship, then obviously you will struggle. That's a simple factual knowledge. If your ALS is out of date, please update that. If you haven't done procedural skills course, please do that, because these are the things that you will find it difficult when you're working in Australia. You might be very proficient back home in your own country, but if you're out of date, please put that on your CV, because that reaffirms the confidence of your employer that, look, they have done these courses, and I know for a fact that they are meant to be doing night shifts, and we do get a cardiac arrest on our night shifts. Are they capable of handling that cardiac arrest? Oh, they meant to be doing suturing, cannulation, NG tubes, catheterization, lumbar puncture day in and day out. How do I know they can do it proficiently? They're not going to go by your word and say, oh, I'm proficient and competent. When you put yourself down as a course, that means you have attended a formal teaching. And what good of that teaching if you've done that in Australia in recent months? So please do consider procedural skills course. I don't say that you have to do it through me. Any procedural skill course is important. You need to have good references. People who have worked overseas, they need to uh, train their references that, look, I'm applying for jobs, the recruitment campaigns are starting. You will be getting a structured reference. Reference is no longer about letters which are done individually. They are structured references in communication, in procedural skills, in your teamwork, in your complaints, in your professionalism. So those of you who are still out there back home in Pakistan and India, wherever you are, if you are not professional, if you're late at work, they are going to pick it up. And then you will say, I've not been shortlisted, because your reference has daubed on you that this doctor was not very professional, was coming late and was absent on that many times. So be very careful there. And some of you have got brilliant credentials. Why not, make friends with your reference that, look, sir, if you feel that I do a very valuable service, can you please make sure when the reference comes into you, please fulfill it and send it immediately. And if you think that I'm lacking behind in something, please tell me and I'll do that immediately. You are a trainee doctor. Nobody's expecting you to be a cowboy surgeon or an emergency physician. You are a doctor who is learning. You have to get your doctors over there and tell them that how can you improve. Now, CV is something which is very important, because this is, after all, your CV, which is going to be before the person who's going to shortlist. They're only going to have 30 seconds, if you're lucky, into your 10-second per page, and they're going to decide whether to shortlist or whether to shred your CV. 30 seconds. So your first page should be the major page where everything is coming across crisp and specific. I would give you all a homework. Open up the job recruitment site here in Australia and study 20 job description. Now, you may not have paid any attention and you may have just copied the CV of someone, or you may have bought my CV template and you're practicing. That does not matter at all. It's time to create a difference for your own story. And how does that happen? When you study those 20 job description in general medicine, emergency medicine, don't go get very creative. Just do, as I said, these are the two bulk jobs, two major jobs where you're going to get your first break: emergency medicine or or general medicine rotation. These are the only two jobs that matter. Okay. Read the job description. 10 general medicine job description, 10 emergency. What is an expectation from me? Oh, they're saying that I need to be professional. What does it mean? Oh, I need to be on time. Okay. Oh, I need to be confidentially maintaining when I'm talking to the patient. Oh, I need to be competent in terms of my communication skills. And I need to be also competent in my ALS and BLS skills. I need to be also competent in my cannulation and NG tube and lumbar puncture, all those skills. So they are actually telling you what to put on your CV. They're not interested in your experience because everybody has got some experience. They're interested in what is in that your experience which bears similarity to the job at hand. Now, this is one hell of a statement. You can apply for hundreds of jobs, but if you're not telling them that what you require is what I have by virtue of these, your CV is not worth the page what it's written on. You need to create some difference in your CV. The templates are good because they organize and they project yourself in a very organized fashion. But whatever the content you're putting it in needs to be very specific. You're all individual people. You've all got different noses, eyes, ears. You all look different. Your CVs should look different. You could have, when I did my internship, there were about, I think, 600 doctors who did internship with me in Civil Hospital, Karachi, and in 1700 bedroom hospital. Everyone takes on that internship was different. I used to write my interesting cases. And I used to write and incorporate in my application form responses. And I'm proud to say I never had trouble in getting shortlisted in the UK, even here in Australia. I did have trouble, however, with interview, and that was a steep learning curve for me. I was very underconfident. I didn't know how to answer a question. I thought they were more like Viva question when it comes to the clinical scenario. That was my Achilles tendon or my weakest link. I did take a lot of time to improve, attended a lot of workshops, a lot of mentorship session, applied countless job and countless interviews. And that's what brings you to that perfection level where you can then, define your own pathway. And, once you've got your perfect CV, practice for an interview now. The campaigns are starting in next 3 months. Okay, you will get shortlisted, and the shortlisting trajectory is like this. May, you might not get any. June, yeah. August, September, come October, November, December time, that's where majority of the first job candidate will get shortlisted. Trust me, I tend to normally take holidays in December, January time. I go overseas to Karachi, and my mom is like, Rizwan, क्या कर रहे हो ये सारा दिन? तुम ये लोग कंप्यूटर पे बैठ के तुम इनके क्या सीवी की तैयारी कराओगे, इनके क्या इंटरव्यू की तैयारी कराऊंगा? मैं कहता हूँ मम्मी मैं क्या करूं, अब सीवी किसी ने बुक कराया तो आई हैव टू रियली फैसिलिटेट दैट. So you have to understand that your chances are great at the end of those years, but that doesn't mean that you won't get shortlisted. Maybe it's a steep learning curve for you.
Yes.
All right, so you need to start working on it now. All right, so prepare for interview. sit in front of the mirror, go through the questions in your CV, create example. The interesting cases, every interesting case has got some value. I remember this one time, I'll give you a story because some of you might not know what I'm talking about. I was working as an intern in Civil Hospital, Karachi, and it was a neurology ward. I was doing a night shift, and I got called by a nurse that there's a patient who is in mid 60s and he's in distressing amount of lower abdominal pain. And can you come and assess him? And I said, well, I'm just an intern. How can I help? We call the surgical registrar. She said, no, you have to come, see the patient, assess the patient, and then call whoever you need to call. We don't do that. We are nurses. I said, okay, fine. So I went to the patient and the patient was doubled up. He was literally screaming in pain. I said, oh man, I don't know. I have never seen something like that before. And I went and examined him. I had, a very panicked approach, but then I contained myself, calm myself. I examined him from every point of view, had his blood pressure and the chest examination and abdominal examination. When examining, I said, the upper abdomen is quite soft, but the lower abdomen is quite tender. And then I felt that he's actually got a bladder. And I thought, oh, when I was doing a surgical job, people who had urinary retention used to present in that way. So this guy is in urinary retention. Okay. So I put the catheter in, the urine came out, he was relieved. He was giving me a lot of du'as and, a lot of praises. And I was like, fine. But what I did differently, which nobody else might have done, I wrote about it. That the nurses called me up for a emergency in the ward, which helped me clinically prioritize my different task at hand during a busy night shift, went to the patient, assess, discuss with the senior, relayed my findings. The patient seems to be in acute urinary retention. I would like to go ahead and put in a catheter. With the help of the nurses, I did establish the catheter, send the urine for culture, and that's what my learning was, that initially the things may feel they're very complicated, but the assessment and the management could often be very simple. All right. So you see, you can turn around even a very small example into a very multifaceted. You have to break it down to how you took it. And there, I'm 100% sure that you've got numerous examples in your career. Now, as I said, these are the basics. Now, people often ask about clinical observation. I did lots of clinical observation when I was looking for my first job. I think that sort of restores the confidence of the employer. And, this is a time where you need to make friends. Go to your local general practices, go to the local hospital. The hospitals are a bit iffy here in Australia. They may not get you, but please, if you're sitting here in Australia, you've got a career gap, you've done your recency, don't waste time. Please do clinical observation. You need to make sure the first job will happen when you're around doctors. I was reflecting on a advice which my father once gave me, that Rizwan, you need to get out of the house every day. Every day. Find a reason to get out of the house. And if you're looking for a job, well, you're not going to find a job unless and until you're near a hospital or a clinic. You need to show that on your form, that I am mixing and mingling with the people who are currently working. And trust me, you will see patients, same kind of patient you'll come across. I saw a patient here who had a bad news broken about a cancer in a general practice. Is that not relevant to a hospital practice? It is. I saw a patient who had, some management plan for asthma, a pediatric patient. Is that not relevant for a hospital practice? So why do you think that you're doing yourself a disadvantage when you cannot get into a hospital observational training program and you cannot go to the GP? You can. It's only how you treat your experiences in a way. If you're treating your experiences like, yeah, anybody else. I've done clinical observership. Trust me, many of you have done clinical observership. But if you really are able to absorb the components and the content on each day, I've got to see one thing important. I've got to bring something back from my clinical observership today. That skin cancer, that, breaking bad news, that communication about, contraceptive counseling, something that I take out. Maybe it'll help you even in your AMC clinical scenario about contraceptive. That seems to be a recurrent theme about AMC clinical. So find your own learnings from everything. If you are still back home where you are, then obviously, as I said, ED or medicine work, ICU cardiology work, that doesn't really matter. Don't complicate the already existing very simple equation of getting a job. Keeping it simple is important. It's about the content, how you describe the content. You can do a trauma course, you can do an ALS course. I think at this stage, who are people who are looking for the first two jobs, ALS course is what is required. Okay. Um, Fine. Look, I mean, if you can publish, why not? If you're just twiddling your thumbs, you're not doing anything else, publish. I don't mind that. But own your publication. It should not be someone who is just, looking at uh, and being a third or fourth author. Own the publication, that look, this was the research that I conducted. The method of research was observational or cross-sectional or randomized controlled trials. So you can speak a little bit about it. Okay. And I cannot emphasize this enough. AMC Clinical is your friend. Now, you may not think so. You may think that you are going to get WBA, and you are right. You may get a WBA, but trust me, I think as a first medical job, you'll be very lucky to find a WBA position because they're just oversubscribed. So hospitals where I work or I have worked, they tend to have a waiting list of people who are already working with them to be given a chance into a WBA program. There's no increment as such into WBA position that has come to that, oh, the numbers have just suddenly doubled. Because AMC is already struggling to keeping the WBA providers on board. There's hospitals are busy. The winter months are coming, they're going to be super busy. So taking WBA providers on board is going to be a bit tough. So study for AMC Clinical. I want all your CVs to say that we are studying for AMC Clinical. Okay. And once you pass AMC Clinical, you're automatically improving your chances. You can apply in states like Western Australia, a lot of jobs there, better salaries there. Northern Territory, a lot of jobs there, better salaries. Okay. New South Wales, Liverpool, Sydney, a lot of jobs there. Okay. So it's about, creating a quality content there. If you're not really doing that to yourself, you're disadvantaging yourself and you're wasting your time. All right. So when you're in your job, say for instance, you've been lucky. We've moved up now. We've talked about AMC1 and we've talked about first job. Any questions from that point of view? We'll just note that questions down. I'll open up the question panel at the end and we'll talk about it. Say for instance, now you're doing the job. How can you improve your chances to get into, your training of your choice, GP, specialty, surgery, ICU, ED? You need to do that job very well. You need to make sure that you pass the AMC clinical. You need to be efficient. And you need to, again, have better Australian references. You need to also be thinking about having rotations in ED in your first job. So sometimes you can negotiate because general medical RMO stream may have geriatrics and pediatrics and ONG. You may say that, look, give me a 3-month rotation in ED. Why do I say that? Once you've got an ED rotation in Australia on your CV, trust me, you are practically unemployed. Like you cannot have a condition where you cannot be employed. So ED restores the trust of the employer to like 100%. They will gain confidence. This doctor's work in ED in Australia, fine. They can do and deal with anything. Okay, so have the hospital put you 3 months for an ED position. Okay, and do when presentation. So I see lots of IMGs taking a back seat when they're in their first training position. Find a way, talk to your mentors that can I present an interesting case at the local educational meeting, weekly RMO teaching meeting. Be proactive, be professional. Okay. Further down the line, you will come to a stage where you'll be applying for a full APRA registration. At that point, you need to be very seriously thinking about, what you want to do. Do you want to go into physician's training? Do you want to go into a general practitioner training? Or do you want to go and do critical care pathway? Think like people how they think here in Australia. In their second year onwards, they are very committed what they want to do. First year, fine. It was a bit of an experiment, bit of a hard yard because it was. But second year onwards, you need to be very clear what you want to achieve in your life. Because otherwise, you'll be wasting your time and committing yourself to a whole lot of disappointment. Okay. Even if you want to become a GP, there's an exam for AGPT. You score well in that exam, you get better training positions. You score poorly, you get thrown out in the rural whoop whoop center or somewhere like that. So please don't think it's the end of the game. Don't take a back seat. Okay. And if you want to gain entrance, if you want to become a cardiologist, why not? If you want to become an orthopedic surgeon, why not? If you want to become anything, why not? You just got to make sure that you do the things which local Australian doctors do. There's no point asking anybody this question that if I pass AMC, what are my chances of getting into dermatology training or orthopedic training or neurosurgery training? This question is not valid for you at this stage. What is valid is that you need to gain entrance into the first program, which is generic. ED training, general RMO training, does not matter. I've seen people who have trained as an RMO in medicine for 2 years and then getting onto a surgical training program. If anything, it creates diversity in your CV. Okay, you're not going to be operating appendixes in your first year in Australia or putting intramedullary nails or intubating patients. That's not an expectation for a good orthopedic trainee. Good orthopedic trainee is a safe doctor who's good in communication skills, who is reliable and professional. All of that can be achieved in a general medical, ED, or basic surgical job. So please try to understand this fundamental concept. You need to keep yourself broad and target on the jobs which are in abundance. Okay. And as I said, plan your exams, plan BPT, plan the steps of FR FRAX exam or ED exams, or at least be in a know that you want to do that. And trust me, people often think that specialist training is hard. It's not. Once you're committed, you're young. If you're, I would say if you're less than 36 or 37, you should give every possible chance to get into a specialist training. A specialist training program, 5-6 years, you'll be laughing. You're no longer working you'll always be working in a city. You'll get a job in a city. You'll have your life set out in a different way. So if you're working in a best country in the world from the medical training and medical jobs point of view, why not aim for the best specialties? Unless and until you're hardcore general practitioner and you want to, do that thing, that's entirely up to you. I'll move on to GPs because obviously some of you are committed in that pathway. So when you're a GP, there are pathways of AGPT or specialist recognition pathway or pesky interview pathway or fellowship support program. But my advice would be to aim on first thing, which is to get the general registration, which is still through hospital medicine. There is no direct entry into the GP program apart from pesky interview, which means that if you've done AMC1 and you're on limited registration, you can do a pesky interview, which may limit your work into one general practice, but you would still need a full registration in that. So if you can do that full registration in a hospital medicine where there are lots of jobs, then it's much better outcome for you. You'll have 12 months of solid hospital experience. You can get into a good program in GP training pathway. You can also, choose to do a pesky interview after that or FSP program. You can have a very good, recently we put people through FSP program, but now they're only taking people through general registration or after general registration. So you've got to understand general registration is going to be your rate limiting step here. Okay. Unless and until you want to really ground yourself to a pesky pathway, which I'm not saying it's wrong, but it's just a long way of achieving that. Okay. And then there's a new program which has come out, which is called pre-fellowship program. Now, on paper, they can take people in limited registration or provisional registration or full registration. But trust me, the GPs are not going to give you a job with limited registration. They just don't have resources. They don't have GPs to supervise you as hospitals have doctors to supervise you. You know, when you get your first registration, it will be a level 1 registration, and it will be saying on your registration, you will be working under supervision. GPs just don't have that kind of luxury. So they say, not general registration, come to us and we'll look after you. Anything before that, you're too much of a headache. They will cut corners on your salary. They'll cut corners on your hours. You will be made to work like a labor force. लेबर वो जैसे वो दुबई में काम नहीं करती लेबर, पाकिस्तान और इंडिया से जाके वो 40 डिग्रीज में, you'll be like that. So just don't accept a substandard training when you can put a little bit of effort now and come out on the top. Okay. Now there is a website, you can take a screenshot of this one, Map My Career. And it's obviously a New South Wales health website, and it is for medical students here, which gives you some sort of numbers in terms of what the training numbers are in orthopedics, in pathology, in emergency, which are the specialties which are oversubscribed, including general practice. So it would be worth looking into if you really want to see how competitive are various specialty. Obviously, there are certain specialties like neurosurgery, cardiothoracic surgery, which don't even open up for training position slots for a number of years. I don't think cardiothoracics are opened up for training slots, or they may have 1 or 2 slots of trainees every year, 1 or 2 slots. So if I'm giving you a hope that you're going to get into cardiothoracic training position after passing AMC1, I'm not guiding you right, correct? If I'm telling you you'll get into your neurosurgical training into the first year, there are about 50 or 60 people who are working as unaccredited neurosurgical registrar here in Australia, who are Australian graduates, and they're wanting to get onto the training program. I'm not right. Yes, you might be something out of this world. Your communication skills exemplary, your presentation skills 100% good, your CV and matter, you may beat the odds, but the chances are, if you belong to an average pool because you're starting out in Australia, which is kind of expected where I started, then obviously not the first best choice to get an AIM orthopedic neurosurgery or plastic surgery training. Start generic, as I said, start RMO, start general medicine in ED, and then second year, really pinpoint your and then work for that. I want to become a surgeon. I need to target, because then you'll have, you'll apply for 8 jobs, you'll get shortlisted for 6. Right now, you apply for 100 jobs, you'll be lucky to get shortlisted for 5. So you can choose your own vices. So applying for a career. So, every state has their own dates, and, they are in different part of the year. But essentially, starting from now, all the way up to, I would say, August would be what is called the first round. There's no such description of first round or second round of recruitment. They are unofficial terms. But yes, the first round is that the campaigns are started now. And the second round is when the people shift and they've still got job vacancies, which they always do. And you'd be very important. It would be very important for you to focus on those second round of recruitment, which starts from August, September, October, leading all the way up to November, December when it comes to the interview. And you may get, if I was to create an ideal circumstances, you should be getting shortlisted here now. Your CVs should be polished. You'll know and learn how your CVs would be competing with everyone who is currently working, but that doesn't mean that you won't get shortlisted. You may get shortlisted, you may get a couple of interviews, but you learn from it. And when you've got a better chance of scoring a job, the odds are better, then at least the CV is up to date. You know how to interview because you've already done an interview or so. Right now, you might be facing a competition of 10 to 1. But in the second round of recruitment, the competition might be as low as 3:1 or 4:1. So, but in order to make that 4:1 or 3:1 work in your favor, you need to have completely understood what it is the requirement of application and interview. It won't be like, okay, yeah, September mein jobs aa rahi hain, I will just worry about that in August onwards. It doesn't work like that, man. You need to have put solid effort in now. Okay. Now, So most of you would be applying for HMO or RMO roles. And most of you will be getting a level 1 registration, which is an ideal registration, which means that you're starting off with direct supervision. Level 2 supervision, if you've got like 3-4 years worth of work in a good medical setup, then you might get level 2 supervision. There are people who have recently come across who were taking their contracts off. So they were like offered a job, like they had the interview was successful, but once they applied for the registration through APRA did not give them registration. So this is a very strict rule. If you have applied for level 2 supervision and your CV does not have job experience to match that level 2 supervision, APRA is very strict. They will say, no, we don't agree that your CV is solid enough to give you level 2 supervision. Simple as that. And even though hospital wants to give you a job, APRA will not give you registration. Go figure. So level 1 is a very safe bet. Level 2, if you got 3 years plus senior medical office experience in your own country, and then the quality of your CV is so important. Those references which are speaking on your behalf in your absence are so important. Correct? And SRMO jobs, yes, for level 2 supervision must have at least worked for 2 years, it says, but I say 3 years plus if you're an IMG. And then there could be unaccredited training. Now, if you've done some degree of training program in Pakistan or India, or then apply for unaccredited training, but that means you should have at least had more than 3 to 4 years of experience back home. Okay. So these are the grades, and please be very careful, because now when you're applying for unaccredited training, the level of supervision is level 3. So all of the MRCP people who are coming in through PEP pathway, MRCGP, sorry, people coming in through PEP pathway, they are given jobs in general practice at a level 3 supervision, which means fundamentally that they are able to work independently, and the supervisor is only available if there's a need. So that's a kind of trust that everybody's putting in you. And all the specialist applications that I assist with, again, level 3. Okay. As I said, don't have career gaps. If you got career gaps, start thinking about recency now. Plan your recency. It doesn't really matter. You can apply for jobs from anywhere. You can be in Pakistan, you can be in, anywhere in India or wherever you can find work, and you can keep on applying. It's a free process. Maybe internet is a bit better in Pakistan compared to Australia. Certain places in Australia has got basically pathetic internet. All right. Yesterday, I could not get any signal in the internet. Honestly, I was like, man, like I could not even download. I wanted to leave a bad review for a restaurant. I could not. Maybe they jammed their internet around or towers around. I could not leave a bad review for a restaurant. Anyway, so just saying that if you have got gap, please act upon it now. Start looking for jobs. And tell me when you've got those jobs, how to put those jobs in your CV is also important. Recency of practice. You can find all that information everywhere you go. It's pretty much standard. There's no two ways about it. It is simple as black and white. If you've got a gap, you only need recency of practice. And yes, there could be an exception. You may find people who've got a career gap of 3 years and they've been given a job and they've been given a registration. But there are exceptions. Why do you leave yourself to that exceptional chance? They may have done zonks of work before that. They may have done lots of experience before that. So, and vaccinator, medical receptionist, tutor, telehealth doctor do not compensate for career bias. As far as I'm concerned, it does not work that way. Okay. Observership, as I said, they're important. There are observership programs throughout Australia. Work around them. We have got an observership program. I think the next intake is in August. So if you're in Sydney or Melbourne, you can join our program. We're not even interviewing now. We can offer you a place directly. So think about it if you want to have a solid chance. The times are important. Our next program is in August because I want you to benefit or draw the maximum benefit so you can put in your CV. I'm currently doing an observation in that practice. And our program is kind of, bit different because we do live sessions every day, every week. And we tend to encourage and squeeze what did you see in general practice. Let's make sure that this experience finds its way onto your CV. So think about that. As I said, it's not about the act of doing it, but the quality of doing it which matters. Okay. um yeah, I don't think I need to talk about it. You probably all know about it. Now, what about the CV? What is a good CV? Probably this is a one of the important questions. So yes, there are basic sections which you should all have. Sorry, we should all have. These are the 6 sections which is the CV essentially. Now you may like to follow the APRA format or Queensland format or Victorian format or my format, whatever format you choose. These are essentially all the things that you need to justify. It's not complicated. It's quite simple. But as I said, it's the content, the information within which matters. You need to be so true and honest about it. And sometimes, when you're honest about, look, I worked in this very rural place, I worked in a very rural setting, it may resonate well with some people who are shortlisting you. That, look, this doctor has worked in a very basic hospital. Obviously that hospital must have been resource challenged. There were fewer doctors, there were fewer supervisors. That means that he might be good at certain things, communicating, transferring patients into a bigger hospital, recognizing a deteriorating patient early, and then transferring them into a more definitive facility. So maybe he's got a skill set which is really required with our jobs. So don't disregard any of your experience, even though it might be from a small hospital, a private hospital in very remote place in Pakistan or India. Everything matters, provided you're honest about it and you're able to put that. Nobody's expecting you to put the skills like for your first job, intubation, central lines, inotropic support. If you've done that, brilliant. What they're expecting you, are you a safe doctor? Are you able to take history well? Are you able to examine the patient? Are you able to present your patients in a very succinct and very organized and structured way to your consultant and senior? Are you able to, do your duties with professionalism without calling in sick? Are you able to recognize the patients who are going through real emergencies and escalate them to your consultant? Now, obviously, the way it works in private hospital back home in our country, you don't have that level of supervision, but there's always help around. I used to work in a small private hospital called OMI Hospital in Pakistan, Karachi. I did that after my internship, but there's already always someone available on phone. We used to have an ICU senior doctor who was perhaps a little bit more senior than me, but I had an avenue of calling someone. And you can say that, look, I had the support of a senior doctor. It doesn't have to be a consultant, but at least you're making that content relevant for the local jobs. Now, let's go through some basic ideas. I like CVs which are simple, aerial, bold headings, black and white, no graphics, no photos. I've seen recently photos have come back. People are doing like really putting out their photos. I'm not sure why, but it doesn't give you any favors, especially if you're not good looking. But anyway, I'm, I'm just putting it out there. You don't want to disadvantage yourself with certain photos. Avoid tables and lines. Just put it out in a free format. And 2 sections, 3 sections per page. Make sure it's good. So that's my first thing. That's Priyanka Mehta, someone I've just created out of thin air, who's done different things. That's where she lives. Don't dial this number because I don't know where it's going to connect. So you cannot say, Priyanka, Dr. Rizwan was sharing your CV. No, this is an imaginary character, okay? And I've got nothing on Priyanka. So, okay. And then you put down your qualifications registration. Nice, simple, factual. There's no two ways, nothing too complicated about it. Okay. So where does it get complicated? Here, when you talk about your clinical experience. Now, as I said, you might be working in a clinical observation in Vaga veterinary practice. You say when you're working, learning outcomes. Remember, I was telling you, if you've seen anything interesting, well, why not create an example. And you need to learn the art of condensation. Unfortunately, this is the generation where the attention span is very narrow. They're all addicted to Instagram and TikToks and all that. So you don't have much time, honestly. In fact, I would I would probably say recently I'll share an interesting story with you. So we were hiring for our company, Emergency Focus, and people actually send me their videos that look, Dr. Rizwan, this is what I am, this is how I look like, this is my communication skills, and this is what I can do. I can really lift up your Facebook page or YouTube channel. I said, oh, wow, this is a new way of talking about yourself. So maybe next year it'll all be TikTok CV. Who knows? But till then, this is still an official way of doing that. And when you're justifying your medical rotations, put it in there. And brief clinical and non-clinical responsibility. And this is so important. And especially, Wajiha, I want to address you here. This is so important because this is going to really stand out. So that's when, remember, I was telling you that you need to read 20 job description. You need to find those job descriptions here in your clinical responsibilities. Okay, you need to make sure that match of the job description that you're applying for and your previous work marries, and that needs to be condensed then to 4 or 5 lines, because you are applying for a junior job. This is a generation which have got a very narrow short attention span. You cannot take half a page, you cannot go beyond 5 lines. End of story. No matter how good it's been described, but it's just not valuable. You're just wasting their time and your time. So that's what I'm saying, that when you're applying or modifying your CV, it's a steep learning curve. Trust me, I had a horrible CV when I went to London, and I was doing my first clinical observation in St. George Hospital in Tooting. And there was a doctor called Dr. Arvinder Sadana, who was an emergency physician. He said, why don't you show me your CV? And I was like, I don't know. I had this thing that my CV has been done very well. I used to write articles in Dawn newspaper, and I thought, oh, my CV is just going to be so good. And he said, no, this is nothing. You've not told me anything about what you do, what you can do. And he shared his CV with me, and I based my CV, and it was 5 pages. He said, no, you need to condense it, bring it down to 2 pages. And I did that. And then I start getting shortlisted. So remember, mentorship is very important. You can do it alone and you can keep on wasting time. That's fine. But what Simra does and other people do, they can look at your CV, because we've had experience of CVs who've been shortlisting. At one stage, I was actually shortlisting the CVs which got sent to me, because I had to, because they were shortlisted for a job interview. So I said, look, there is consistently a good quality template which has been followed, and they've been shortlisted. And this is the quality which is an expectation. And that's what took me to create my own ideal template. So template is one thing, but then the content is so unique in those CV that it just works. And one thing which has been consistently there for the doctors, it's the content, it's the condensed information. Okay. Now, when I'm helping with these specialist applications these days, they are also due to be describing their, what are your clinical responsibilities, and they fall apart. But I want you to think about your clinical responsibilities in, your ward work, your on-call responsibility, and any other non-clinical responsibility. If you stick 1 or 2 lines for each one of them, what is my ward work like? Okay, fine. I start my duty at about 7. First of all, create a profile of the hospital. That you look, this is a rural or regional small private hospital, but we are in a jurisdiction of 50-kilometer radius of big tertiary hospitals with specialist services in pediatrics or gynecology and neurosurgery and trauma. But that means that we do get a lot of trauma um, um, come to our hospital doors, which we have to transfer. Fine. You've created a profile. So when they Google up your hospital, they can see that he's not lying. He's telling the truth. He was working in a small hospital, but that small hospital was a conduit to referring patients to a bigger facility. And that means stabilizing the patients. So this is a very important skill. They were taking the patients in, stabilizing them, packaging them, organizing a transport, and sending them across. Um, that's your responsibility. When you're working in ward, what kind of responsibilities did you have when you're working in ward? Well, I had, it's getting boring when you write, oh, I used to take history and examine the patient. Clinical prioritization, condense the word, thorough patient assessment, escalating deteriorating patient. What's the point of writing, I was taking history and examining the patient? That's what medical students do. You need to find the words which are in job description, which are exactly that: escalation, prioritization, emergency, targeting deteriorating patients. Okay. And non-clinical. There's no point in writing. There was a teaching sessions for January, which I presented in. I was quite interested in dengue, which was quite endemic in Pakistan. So I presented 5 interesting cases of dengue. Well, when I was working in Sri Lanka, there was in monsoon season, we had lots of snake bites. I observed 5 or 6 snake bites, and I presented a case on snake bites assessment. What it does, it just creates a unique you. It creates a person out of those sea of average people. Nothing important. You're saying the same things, but just different. Okay. Clinical procedure skills, don't spend too much time there. Nobody's expecting a lot from you, but to put in a cannula, suture, and all that. So just find your comfort zone out there. You can divide them into, competent and observed. However, for your first job, you don't have to write that I have observed intubation, or fine, you can say that. But the main skills which I need: basic airway management. You've done an ALS, you've done an ACLS, you've know how to suture, you know how to, you know, uh, put the plaster on the patients or do the vaginal speculum examination. The amount of time when I see IMGs coming to me working in emergency, I've never seen a speculum in my life. Oh God, not, not again. I've never done that. Oof. That's not the correct attitude. So even when I talk to local Australian graduate, I said, look, you cannot say that I've never done that. I say that, look, this is something I've already seen done a few times on YouTube, and I'm very keen. I've got my tray and table ready. Can you come and please supervise me to do that? That's how you learn. If you say never done that, don't know how it's done, trust me, you'll keep on saying that for the rest of the years. Um, Courses in CPD, do as many courses, clock on your 50 hours of CPD. There's virtually no escaping that. And find CPD courses. There's some free ones, there's some good quality ones which are paid ones. We have got some CPD courses. Clinical orientation is such a good course which I used to do. It's all available as recording. You don't even have to attend the live sessions, but it tells you everything about how to assess a patient in Australian hospitals. Why don't you have those courses on your CV? You must. So everybody who's joining our clinical observation group, they get an automatic registration to our clinical orientation program. Non-clinical experience. If you've been teaching medical student, if you're working in any capacity, do that. References. Now, when it comes to interviews, that's where everything will come to a very needle pinpoint performance. People often confuse interviews with vivas. They're not vivas. They are looking into your personality. That, look, this doctor on paper sounds great. Are they kind of average, above average, or they're exceptional? And if you're talking like a person who's sitting in an exam with lack of personal flavor, you're not going to be successful in 4 or 5 interviews that you do. You'll keep on repeating the same thing over and over again. But if you really create interesting, now there are about 99 people. I'm talking 99 of you. And I'm pretty sure that you are engaged. I've got your attention. I'm narrating examples. I'm creating interest I'm cracking jokes, and you're on engaged with me. Can you not do a similar kind of thing? Yes, you can. Now that takes a bit of a practice. As I told you, I was very poor in my interview techniques. I had never had any trouble getting shortlisted. but I sucked at interviews. I was like looking somewhere else, not establishing the eye contact. I was literally talking about my CV as if I've memorized whole my CV, and I'm just talking about that. And it just was a very boring experience. So I think the people who gave me my first job was basically, they asked me such atypical question which I could not find my CV to be able to do the justice to them. So find examples, interesting examples. There are many ways of doing that. It's like telling your own story. It's about creating a personalized experience. And there are a bunch of people who are expert at what they do. They see hundreds of you every year, and they will pick it up if you're it's very easy. I know, sometimes I used to think, how can they say that I've not done that experience and I'm lying about it? Because the words you choose are so freaking fake. It just sounds you are fake. This, it's so easy. It's like everybody's got like woman's instinct, the wife instincts. The wives are very good at picking up husband's mistakes and all that. So they're so good at picking up those fake credentials. So if you're faking like, oh, I used to do this, I used to do that, then they'll pick it up. Be original. Be say, look, I want to learn this because this is what I feel that I need to learn. And there is, if you give me 5 doctors, of which, one is very basic with a lot of aptitude of learning and enthusiasm, he will get that one job out of 4 people who've got lots of experience. So if you can say that, look, I have got a very limited experience, but I am passionate about learning the procedural skills at JMO level because I want to be the next orthopedic surgeon. And I think this job will help me achieve my dream. Be convicted, be passionate. Tell them what you want. And by God, don't talk about being a GP in your hospital interviews ever, even if you want to become a GP, because hospital just get pissed off that, okay, so we're giving you a hospital job for only you to leave us when you get a full registration. They know that. It's like the same thing when you're coming on a visa, and the visa officer asks you, are you going to come back? You say, yeah, I'm going to come back. So, but you never come back. So same thing with the hospital. Don't say that you want to join a general practitioner. There could be ways around it that you don't have to lie. As I said, it's all about honesty. And you can say that, look, I'm very interested in rural medicine. I'm very much interested in diversity in practice in a combination of, urban care and rural healthcare. I'm interested in Aboriginal healthcare. I'm interested in people um, with social issues. So that is giving them hints that this doctor is interested in a more broad kind of substrate rather than just typical hospital patients. No points in getting that one. When you're getting interviews, you need to be very confident or appear confident. Um, yeah, there's a way of doing that. I can put it and say whatever you like, and you'll trust me on that. But there's a way of actually putting yourself in that way. That means nothing unless and until you've practiced that scenario with your. But I think as a rule of some mannerism, you need to sit up. As I'm sitting right now across you, I look like I'm sitting across the table from you. You need to have a clutter-free background. You need to have a silent background. You need to listen carefully. Sometimes people go on about expecting that this is the answer, but that's the wrong answer. So you need to listen to the question very carefully. Give it a pause and then answer. And establish the eye contact with the camera. And divide your answer. So they may ask you, can you tell us something about yourself? Which is a very generic question. It is often the first question. You may say that, look, this is the time which I feel that I am quite appropriately qualified and trained to have my first job here in Australia. And I'll tell you exactly why is that. I've passed all the necessary licensing examination. I think my last job in India or Pakistan gave me that sense of working in a better resource center, coming from a center where my hospital was not adequately staffed, resourced, and there was a lot of patient challenges where I think my learning seems to be a stagnant level. And I think working in a good hospital may achieve that. And I'll give you an example. Look, I was working in a pediatric hospital where we did not have patients who could have phototherapy. And our pediatric population, or pediatric, some of the nasty jaundice patient would go into kernicterus. Something simple as that. I remember when I was working as an intern in a medical ward, there was a patient who came to me from very rural Sindh village. They came to our ward, and she was in DIC from a septic abortion. Okay. And she needed a cannulation, because when you get into DIC, your whole body is swollen up, and she needed a cannulation, and nobody could put a cannula in. And cannula used to cost 20 rupees. And I said to her father, go bring 5 cannulas. He brought in 5 cannulas. We tried all of them, wasted. I said, bring on more 3 cannulas. He brought more 3 cannulas. And then when I asked him for the third time, he said, doctor, that's all the money I had in with me. I've got no money. Even if she dies, I cannot do anything. I don't even have money to eat. Okay. So then I went to the local medical center. I said, this is a patient who's going to die. Can you please give us a central line? And they donated a central line. Now that's me working as an intern. Okay. And they donated a central line. We put the central line. We started transfusion, treat the antibiotics. The patient still died. But at least I was able to understand. So if you can create such an example, I come from a very poorly resourced country, but I know my limitations. Can you not talk about that in an interview? Yes, you can. There's got to be something in your boring lives, right? So there's got to be something. You can't be as much boring as you look. You've got to be exciting and smile. Like your faces should have a smile on you. A smile is good. It shows connection. It makes you look pretty even sometimes. So yes, smile a lot. All right, now answering 3 sections, lay out the headings, what you're going to talk about. Clinical experience is important, personal quality is important. As I said, examples are important. That's the most important thing. So you'll get a question about yourself, qualification, clinical scenario, clinical prioritization, personal qualities, and workplace conflicts and complaints. You can pluck out your own example in each of these crucial sections. If you don't have them, do it now. Because if you don't, then don't complain. Australia does not give jobs because it's your fault. Okay, you need to find examples from your CV. I've given you 3 examples today. I've got countless examples. Being an intern, I'm sure you all have done a good internship in a good hospital. Okay, so you must have good examples there. You need to just think and do yourself a favor. And if you are able to come up with a good opening statement with a good example, good clinical scenario, approach, clinical prioritization I've talked about, that you were working in rural, regional, busy urban setting, no antibiotics, no cannula, poor population, personal qualities. What is your personal quality? There's got to be something about you. I'm pretty sure as a good doctor, you have achieved countless things which stand you out. Okay. So try find out about that. And then clinical governance is important. It's all about patient safety. And you can find plenty of example in which you intervened, the patient being abused or the doctor being abused, or, there was a complaint that you were involved in, or what did you learn from it? And then, you can talk to your mentors. We can, we can improve those example into a more punchy performance. But each of these example have to be you. It has to be you. It cannot be my example, because my example has been going around in circles. So if you use my example to say, oh, I've heard about it 20 years ago. ये तो वही बात कर रहा है, ये जो रिजवान करके गया था 20 साल पहले, तो पुरानी नहीं हो गई कुछ थोड़ी सी. So create your own examples, okay? And yes, adjustment to the Australian health system is important. If you have not really displayed, AMC is not an adjustment to an Australian health system. It is simple as that. If you're working as a phlebotomist, yes. If you're working as a pathologist, yes. If you're working as a collector of some sort, yes. Vaccinator, yes. If you're working in a GP center as an observer, yes. You need to find your own ways of doing that. And then they'll give you some chance to ask questions. Always have good questions about the job. There is a reward at the end. And that reward is much more beautiful than you expect. You get full registration, you get permanent residency, you get paid lots of dollars, you can support yourself and your family, you can have brilliant future here in Australia in whatever specialty you choose. And it's just a matter of putting in the hard work. And unfortunately, AMC is not that hard work. It's the easiest work. It is the basic work. Like I often give an example of building a house. The more beautiful your house is, the better you're going to sell it, right? It's exactly that. AMC is that foundation. It's just a plot, it's just the land. You need to have the land, and then the basic framework structure, your clinical experience. All right. And then everything that you put on, the colors, the lights, the decoration, is going to laden with your ideal credentials that, yes, we want to buy that house. We want that house. So please try to understand that it's not that I'm discouraging with any way, but I just want, if you plan everything right, I've shared the example of Arvind Madras, Mehreen, Fatma Adial, Salman Qureshi, and so many other people who are working as radiologists, anesthetists, ICU surgeon, and you could be one of them. I myself struggled with interviews. Simra struggled with interviews as well. So we have to start at some point, and that point needs to be the game-changing point in your life. You cannot keep on making the same mistakes thinking that AMC is my game changer. It's not. It's just the plot. It's just the land. You need the foundations. You need the everything in that building to be sellable. With that, all right, take care and look after yourself and each other, and we'll catch up along. All right.
Good luck, everyone.